Away from that, and the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU have issued a one-month strike notice to the national government to address critical issues such as comprehensive health care for its members, deplorable working conditions, the failure to honor labor rights, and delayed payments, among others. Now, while questioning the government's decision to control certain services the doctors can access under the Social Health Fund, KMPDU Secretary General Dr. Davji Atela said that failure to restore the comprehensive health care for its members will result in a nationwide strike. Gloria Musimbi with more.
Medics under the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU have rejected the recently implemented Social Health Fund that they claim denies Kenyans access to comprehensive healthcare despite the substantial contributions through 2.75% gross salary deductions to SHIF.
We are also saying very strongly that 2.75% contribution that is being put upon the workers is an outright exploitation. It is not logical for the government to institute 2.75% on the gross salary of workers without giving consideration the income of the workers. We have seen many Kenyans and many doctors particularly who already are below a third rule. Many of them are in loans and in debt. And therefore, if the government goes ahead to infect the 2.75%, it will be sending most of the workers or most of the doctors to an inability even to manage their daily subsistence and their daily services.
KMPDU Secretary General Dr. Davji Atela raised concerns on the deplorable working conditions experienced by doctors in various counties, noting that they undermine their constitutional right.
We condemn in the strongest terms the blatant disregard to the welfare of healthcare professionals who, despite the unwavering commitment to the healthcare and well-being of the Kenyans, find themselves subjected to deplorable working conditions and have now been forced to down their tools, as I've said, in Homa Bay County and the one that is coming up in Uasin Gishu, in Elgeyo Marakwet and in Kitui.
KMPDU has meanwhile called on county governments to fully implement collective bargaining agreements CBAs.
That Machakos County, that over a long period of time has promised to sort out the issues of CBA, but they have remained unimplemented. We cannot continue waiting for the county to give promises, to do public relations, with the plight of healthcare workers remaining unattended to. For Makueni County, in a similar manner, has decided not to implement the CBA and the Kwale County. And we are going to follow the same steps that we have done for Homa Bay and Kitui and Uasin Gishu and issue them the strike notices.
The union has blamed county governments for not addressing issues raised that have led to deterioration of the health sector, including the retraction of contracts that were offered to medics recently.
We want to warn the county that it's not just the issue of those doctors, it's an issue of healthcare services in Nairobi County. And therefore, those doctors does not need to be discriminated. Most of them were subjected to bribes and to violation, of which the union has come out strongly, and if need be, next week or the week after, we are going to issue a strike notice to Nairobi County. We demand for comprehensive cover for our members. Failure to read this call will force the union to unprecedented strikes. And these issues that we are demanding are things that we won't compromise on. The medical cover, the employment of doctors, the posting of doctors to the internship, the implementation of the collective bargaining of 2017-2021, the implementation and negotiation of the new CBA, these are things that we won't compromise on. And as we continue the discussion and the conversation, we have already seen a trend among the 10 counties we visited. The doctors are out and ready to go for a strike.
This as the KMPDU continues to raise concerns on critical issues such as inadequate hospital equipment, insufficient drug supplies, the failure to honor collective bargaining agreements CBAs, and delayed promotions, among others. Reporting for OpTV Newswatch, I'm Gloria Musimbi.